How to avoid bleeding gums and gingival overgrowth when you have braces? Simple questions, but difficult answer. I'm Dr. Olga Dolghier here at Pediatric Dentistry and Orthodontics. My gums are bleeding no matter what I do. I floss, I brush, I do everything like my dentist said, but my gums are still bleeding. Tell me a young girl with braces on, and when I look inside your mouth, oh yes, she does. She has bleeding gums on every single probing. So why this young girl has bleeding gums? Let's dig in and figure it out. Reasons for bleeding gums. Number one, not flossing or brushing consistently. I'm too tired, I'm just gonna go to bed. And you didn't floss and you didn't brush and you went straight to bed. And what happened? Next couple of days you did the same thing, and then when you start brushing, oh my God, my toothbrush is red, and oh, what's happening to me? Let's make an appointment. Let's make an emergency appointment. Something happening to my gums. Well, a lot of times you have gingivitis. What gingivitis is? It's the early stages of gum disease. It's when your gum become inflamed because you have a lot of plaque, bacteria is multiplying, they're breathing all over your gums, and then you have bleeding gums. Then what happens next? If you keep doing what you're doing, not brushing, not flossing, with braces on, your gum's gonna actually grow bigger and bigger, become more and more inflamed, and sometimes we look at your mouth and I don't see even brackets. That's how big your gums get. And then your dentist may tell you, after braces are off, you might end up having a surgery on your gums. Do you want to have that? Probably not. So let's figure it out what to do. Number one, consistently floss and brush. Keep your mouth nice and clean, no matter what. Brush after every single meal. Floss at least at night or in between your meals with braces as well, which would be very, very helpful. Also, look at what you eat. If your child or teen is a picky eater, believe it or not, nowadays we were warned on our specialty about lack of vitamin C in a diet. So we are like sailors from 18th century getting scurvy. Absolutely crazy it is, because kids nowadays eat chicken nuggets and pizza, and guess what? They're not getting vitamin C. And now we see more and more deficiencies of different vitamins. With scurvy, you will have bruising on your skin, you have bleeding gums, and you might end up with actually getting loose teeth. And it's all related to vitamin C deficiency. So make sure your child is well nourished and eats right things, or buy them just supplemental vitamins, because I buy actually for my teen kids vitamins, supplemental vitamins, but I don't know how much vitamins they're getting from everyday nutrition. And it's very important because remember, your mouth is a representation of your overall health. If you develop periodontal disease later on in life, usually it's not affecting young adults, but you might have more severe complications. Some study even shows that bacteria from your gums can end up in your heart. And also some cancers also were synthesized that bacteria from the gums related to that particular cancer, certain type of pancreatic cancers actually. That's kind of a news, we still need more research to be done, but it's actually reality. Your mouth is a representation of your overall health. With younger girls and boys, when you go into that puberty, your hormonal changes are very, very intense. You will have normal gingivitis, which you see, and you have to pay attention even more to oral hygiene. People or younger adults and kids with diabetes, you may have bloody gums as well. Kids or adults with diabetes actually may have some conditions which will contribute to bloody gums. So again, looking back, look at everything what you do on a daily basis. The basics are the same. And if you're truly doing good job with oral hygiene, brushing and flossing on a daily basis, and constantly have bleeding gums, you might address this with your dentist first. And if your dentist cannot find the answer, you might have to go to your physician and have full blood panel and making sure you have no deficiencies or any autoimmune or other underlying medical condition, because your mouth is a representation of your health. Share with me, did you have bloody gums when you had your braces on? I cannot wait for your answers, and thank you so much for watching.